about it, ER doctors and prostitutes have a lot in common. Both groups answer limitless human needs that cross all cultures and classes. Both want to be paid for what they do by customers, who in turn want to pay as little as possible. Because of this, both groups work with enforcers who make sure the customer pays. These enforcers also provide an environment for doing business, and they have certain agents who can provide a level of protection against the occasional troublesome customer. In turn, these enforcers collect money from much more powerful authorities, who make their biggest payoffs when they sell a territory to another authority. Now, to make this possible, they have to pressure their enforcers to keep the business profitable no matter what, so that other authorities will want to buy it. One way for enforcers to get more money is by ripping off customers with hidden costs. For the prostitution world, it can work like this. $25? That seems reasonable. Hi, let's have some champagne. And then let's go into the VIP room, stud. All this for $25? Wow. Oh no, I got swindled. And in the medical world, it's pretty similar. They'll take my insurance. I can afford that. We care about you as a person, not just a number. Oh no, I got swindled. Of course, another way to increase profits is to make everyone work harder for less, like making prostitutes service more and more clients per hour, or making doctors see more and more patients with less and less support. You can also bring in more money by recruiting inexperienced workers who you can pay a lot less. Pimps do this by targeting desperate and defenseless populations that are easy to manipulate, and administrators by hiring more non-physicians, new graduates, or by flooding the market with corporate residency programs. Pimps and administrators both appease their workers with trinkets. These are superficial gestures that don't cost much and don't really improve their lives or reduce the risks they're exposed to on the job. And of course, if any particular doctor or prostitute starts making waves or embarrassing the organization, they are often disposed of. But let's be fair, being a pimp or administrator is not an easy job. Prostitutes and ED docs are full of personality disorders, drug problems, and arrogant fantasies. They can be their own worst enemies at times. Prostitutes and physicians will always have work, and pimps and administrators will always be necessary. But since we're complicit in our own exploitation every time we show up for work, it's on us to set the limits. For them, getting rid of someone who's outlived their usefulness isn't really personal, because the person doesn't matter that much, just what they earn and what they cost. But there are a few ways to make yourself harder to replace. Whether you're a hooker or a healer, you can try developing a rare skill that most other people don't have. You can make it more difficult or dangerous to fire you, and you can have a backup plan in the wings so you can move fast if you need to. So what have we learned here? Be realistic about what you are and what your boss wants. If you avoid becoming a difficult, idealistic diva and do reliable work, you might make a good living and even have some fun along the way. But always look out for yourself and don't trust anyone. Don't expect honesty or affection. Get that from someone who matters.